Abnormal protrusion of the eye. Differential diagnosis. Mass effect, for example, infiltration or displacement of soft tissues by inflammatory, neoplastic, or infectious etiologies. Enlarged globe, for example, myopia. Large, myopic eyes frequently have tilted discs and parapapillary crescents, and ultrasonography, US, reveals a long axial length. Asymmetric myopia may present as unilateral proptosis. Anophthalmos of the fellow eye, for example, after an orbital floor fracture. Asymmetric eyelid position, unilateral upper and/or lower eyelid retraction, or contralateral upper eyelid ptosis. Causes: inflammatory, thyroid eye disease, TED, idiopathic orbital inflammatory syndrome iOS, sarcoidosis, granulomatosis with polyangiitis, GPA, Wegener granulomatosis, reactive inflammation from sinusitis, IG4 related systemic disease, infectious, orbital cellulitis, subperiosteal abscess, SPA, mucormycosis, etc. Neoplastic, discrete, infiltrative, or hematologic, typically categorized as primary, for example, cavernous hemangioma, or secondary, for example, extension of sinus mucocele or intracranial meningioma, etc. May be benign, malignant, or metastatic. Trauma, orbital fracture, retrobulbar hemorrhage, orbital foreign body, carotid cavernous fistula, etc. Malformation, skeletal abnormalities, congenital/genetic syndromes, etc. Vascular, usually either congenital or acquired and categorized as primary arterial, for example, carotid cavernous fistula, or venous, for example, varix. Lymphangioma may also cause proptosis from intralesional hemorrhage. Investigations. Hertel exophthalmometer. Automated perimetry of compressive optic neuropathy is suspected. Imaging studies, orbital computed tomography, CT, axial, coronal, and parasagittal views, or magnetic resonance imaging, MRI, with gadolinium and fat suppression, depending on suspected etiology. Orbital B scan, US, with or without color Doppler. Imaging is useful if the diagnosis is uncertain or when a cystic or vascular lesion is suspected. Consider optical coherence tomography, OCT, to assess optic nerve contour. Investigations. Laboratory tests when appropriate. Triiodothyronine, thyroxine, thyroid-stimulating hormone, thyroid-stimulating immunoglobulin, angiotensin converting enzyme, C-ANCA and P-ANCA. Lactate dehydrogenase, IG/IG4 levels, antinuclear antibody, CBC with differential, blood urea nitrogen/creatinine, fasting blood sugar/HbA1c. Consider an excisional or incisional biopsy, as dictated by the working diagnosis. Fine needle aspiration biopsy has a limited role in orbital diagnosis. Thank you.